Assalamu alaikum everyone. I am Dr. Muneeba Ahsan Sayeed, and today's alert is about HIV and the different phases of HIV in Pakistan. The alert is Pakistan is experiencing the second fastest rate of HIV increase in the Asia Pacific region. If we look at the current HIV statistics in Pakistan by September 2024, an estimated 0.33 million people are living with HIV in Pakistan. Of these, more than 72,000 people know their HIV status, and of these 72,000 individuals, around 50,000 patients are currently on antiretroviral therapy. This surge in HIV cases hasn't happened overnight. So if we look at the different phases of HIV in Pakistan, the first phase was from 1986 to early 90s, when HIV was mostly reported in Pakistanis who were deported from Gulf countries. They were all males, and it was also reported in the spouses of these individuals. The route of transmission was heterosexual. In 1987, the first local case was reported, which was due to unsafe blood transfusion. The phase two was from mid-19s to 2003, and during this phase, the local transmission has started. People had no travel history. The route of transmission was heterosexual, and it has predominantly affected males. The phase three was from 2003 till 2018, in which the outbreaks were reported from Lakhana and Karachi, which has affected injection drug users because of sharing of the same syringes, and the truck drivers because of involvement in high-risk sexual practices. It was during this phase that the outbreak was reported in the hemodialysis center in 2016 and in thalassemia center. And this outbreak was due to poor infection control practices. Phase 4, which happened in 2019, was the most devastating one. It was the Ratodero outbreak, and this time it has affected children, and it's only because of the poor infection control practices. So if we look at the 2019 HIV outbreak stats, it was found that around more than 1,000 individuals tested positive for HIV. Of these, 80% were children, and majority were less than 5 years of age. The parents of these children were tested negative for HIV, which was an evidence that this transmission was because of horizontal transmission related to poor infection control practices. So now the question is, why is HIV spreading in Pakistan? It's because the drug user population is more than 5 million, and many are injection drug users. It's also because of sexual networking. Unsafe blood transfusions, the unregistered blood centers are not screening the blood properly for HIV because of our irrational use of injections. Even if injections are not needed, patients demand to get an injection instead of an oral therapy, and the caregivers are using the same syringes among different patients. It's also because of unsafe use of needles. The sexually transmitted infections are not managed properly, and it's due to poor infection control practices in the healthcare facilities, salons, and other centers which are dealing with blood and its products. So since these are the factors which are leading to increase in HIV in Pakistan, it's very important to stop this spread and take the necessary precautions to prevent the spread of HIV. Thank you.